Dr. LeBlanc, tell us about this machine you have where a person can actually walk in and gets a crown that day. Doesn't have to be sent to the lab. A couple hours later, whatever it is, that crown is fully there. No more visit needed.
Yes.
Tell us about it.
Yes. It's called a Cerec helmet. It really is amazing. I graduated from USC in '88, and there was a French doctor there doing some research with one of our professors, and they told us students at the time, one day you'll be able to get a patient in and take some computerized photography, and in a half hour you'll have a crown. And, we all laughed. Well, we've had that technology here for, I'm thinking it's 7 years now. So everything's the same. We prepare the tooth, and let me backstep a minute. It will make a crown, but the neatest thing about this machine, it'll make inlays and onlays. So
which would be like a veneer or lumineer, right?
No, it would just be, let's call it a half crown or a three-quarter crown, or we're taking less tooth structure off, because with the bonding materials we have nowadays, we can bond these in and have excellent results. It's porcelain, so it's white. It doesn't expand and contract like the silver mercury filling, so you don't have that cracking problem. In fact, it can help hold a tooth together. But yeah, we prepare the tooth as we normally would, and then we take an infrared picture of the tooth. We design it on the computer, and then the computer sends the radio signal to the milling chamber with a porcelain block in it, and it just comes out gorgeous. And we have the patient go and look at this tooth being made, and it's a real wow. It's a really computerization is just amazing.
And shades of teeth can be made just the way they would be made in a lab.
Lots of different shades. Yeah, definitely. Yeah, it's really something else. And, when we got this technology, I thought people would think, boy, that's really neat, or wow, I like the technology, or I love the way it looks, or whatever. Helmet, the one thing they say time after time, which makes me kind of feel bad, they go, I don't have to come back? So I guess they really don't like coming to see me, Helmet.
It's quite amazing that you dentists are. I'm sure there are other professions like that, but it's quite, here we come to you with, begging and with your God, I'm having a toothache, but at the same time, while we sit in there, we say, I hate coming to you. Sure, I hate being at a dentist. It's kind of like...
Well, I say we can't make it fun, but we can make it tolerable. Right. And if we have a little fun while you're here and we make it tolerable, and as you're leaving, you say, hey, Mark, that wasn't that bad. I thought it'd be worse. I go, we did a great job together today.
Yeah, well, that brings, of course, up a topic where I think a lot of the dental horror stories, they do come from the old time when, you got an injection, which, the needle, it was a pipe. It wasn't a needle, it was a pipe, and he stuck it in 90-degree straight, and it hurt. Now you guys are numbing a tooth before you even put an almost invisible needle in it. There is no pain anymore. So all that thing, even like orthodontic, of course, our parents who did have orthodontic, they were wearing headgears, and today it's a plastic thing stripped on. You can't even see. It's just the difference is so huge, but we still keep giving, those horror stories.
A lot of it is subconscious. People come in and they're truly afraid. It's like if you get the hammer on the knee and you say, don't move your knee, well, you're going to move your knee. It's a reflex. So a lot of the fears are reflexive. But with the sedations we can offer, the nitrous oxide, and absolutely the anesthetic delivery techniques, let's not call them injections. The anesthetic delivery techniques are so great. There's not a day that goes by that says, wow, when are you going to give me a shot? And I go, you're already numb. And it makes you feel good. A lot of it's technique, a lot of it's practice, a lot of it's caring. But it makes you feel good when they leave and say, wow. Of course, it feels good when they say, wow, but they say, wow, that didn't hurt a bit. So definitely. We have to prove that to them, but we can walk the walk.
And now you can make him feel good in even one visit and get that bridge on it, that crown.
Right.
You know,
people are busy. We forget sometimes how much of a hassle it is to get to the dentist. Sure. So some people have all the time in the world, and they go, let's just space it over time. Remember, at Portola Dental, they are the boss, and they get to decide. Other people, some drive a long way. Some are very busy professionals. They'll come in and say, hey, the most you can get done in one visit, the better. And we can certainly accommodate them.
Good. Thank you very much.